musculoskeletal nodules around the neck, right? So their functions always related to their location. Yeah, study like this way would be a little easier, right? Okay. So just now I upload Excel documents, right? In that Excel documents, they're marked with a star. Okay, marked with star. If they are different from the majority of them are, I should say, almost all of them are aligned with the thing I talked about in the class, right? In the class, I tell you like no star, one star. It's aligned with that Excel table, right? If not match, yeah. So listen to me in the class, right? The class I told you that's the correct one. The Excel for your reference. Okay, for your reference. But like if I mentioned in the class and also manifested on the Excel, that's 3-star. That usually meaning that's important, useful one. You remember location, remember the application. In the future, you're going to use it in your student clinic and also your future, your own business, right, clinic. So it's worth to pay more attention and make some effort to study them, especially to read this commentary parts in Peter Diamond's book, right? Strengthen your impression. Yeah. So the points like without star, right? No star. Yeah, probably. Yeah, if you have energy at the time, yeah, study them as well. If you, for example, you have 4 courses, right? Even 5 in this term, okay. And then there is a quiz, midterm, and final exam season. You're so busy, right? So stressful. Yeah, maybe take some strategy, right? Take some strategy. Yeah. So that's my suggestion. Okay. And the Carla, I saw your message. You have a couple of questions about Stomach Channel. What's that?
Yeah, hi, Helen. Yeah. There was just a couple things that kind of jumped out at me while I was just kind of reviewing. First is a simple one, Stomach 16. I didn't get a star rating for that one. I don't know if you mentioned it.
16. Stomach 16. Did we study that? We haven't, right?
I think we got up to 18 or 19. I think we finished at 18 last week, if I'm not mistaken.
Right, we finished at stomach 18. Oh, okay. You asked me stomach 16. Oh, sorry. Stomach 16 as Yingchuan. I would say not to use it too much. Yeah, you can no star, maybe this one. Yeah. So since it's located in the chest, right, it's actually easy, right? Help to elevate cough and wheezing. And it's also close to the breath, right? So it's benefits of breath. Yeah.
Okay, thank you. Another question I had is why is stomach 12 contraindicated in pregnancy? Is there like a meaning behind that?
Stomach 12, 缺盆穴. 缺盆, basically, when you study your safety of acupuncture safety, it didn't mention that one, maybe, right? No. So stomach 12 is a point, all of the yang channel will go through it, right? So later on, because you haven't studied meridian theory, so you feel confused. But after you study meridians, especially the yang meridian passageway, almost all the yang channels, they go the outside, then go to the shoulder, and will go the front, go through this stomach 12. Some of them goes down, some of them go back to, the upper back and then to head. So anyway, you just take that as a message or information. You don't have to remember that.
Okay, I just didn't know if there's a deeper meaning to why that point, as far as pregnancy, or something else that we didn't.
Oh, okay. If you ask me, I would say that point may easily to manipulate to move the qi because all of the yang channel goes through it. So it's a confluent point of a lot of channels. So that's why if you needle it, it's probably stimulate qi. But to be honestly, we don't use it too much. We have a Ren 22, right, in this level, Ren 22. So that's a good point to treat asthma, cough. So we usually take that one, not beside it. We don't use it too often. Yeah.
And one other question, if you have one other moment.
Yeah.
So I was just looking at how all the channels we're talking about, how they're all on that. We're talking kind of referring to the left side because I guess the stomach's on the left and we were going down the left. But I guess I was just thinking about the right side. There is a mirror image of the channel on both sides, but yes. The right side doesn't go through the stomach. So you know what I mean? Because the organ's on the left side.
Okay, forget the anatomy, Western medicine. Forget that.
Forget about it? Okay.
Forget about that.
I was just because it talks about how these low connecting and divergent channels, they go through the stomach and they go back up to the throat and the head. And I was just what about the right side? The right side doesn't go through it. So I just got thinking that.
Right. I understand. All the pictures. Yeah, we actually borrow the concept or picture from Western medicine, right? So there is no textbook, TCM textbook said stomach, it's in the right side or left side. Stomach is a concept. Okay, so some organ, right, internal organ located in the middle jiao. Largely, it's below the diaphragm. Okay, so don't think exactly the shape of the stomach, not that way. So the channels, they are bilateral. Okay, the points distribute both sides. Their function equal to each other, both sides. Yeah, no difference. Yeah.
Okay, thank you.
No problem. So that's all, Carla?
For now, yes.
Okay, good. Yeah, I think that's good for everyone, to clarify that. Good. last week, yeah, we finished stomach 18, right? We finished stomach 18. So that meaning we finished the chest part of stomach channel. Okay. So when stomach channel goes down to the abdomen, right? Abdomen, it could be above umbilical and below the umbilical till the pubic emphasis, that part. So there are how many points there? From stomach 19 till stomach 30, right? So that is 21 points located in this abdomen, right? Abdomen. So all of those points in this region, they distributed, beside the middle line two. Okay, first of all, that is saying, yeah, it helped to remember their location. And then secondly, almost each of them, their distance between each points, they're 1 cun. That's easy, right? That's easy. So what you need to remember the sequence and the starting point, stomach 19, the ending point, stomach 30, right? So like each point, their distance is 1 cun. Okay, so distribute 2 cun beside middle line, and each point their upper lower, their distance based on the sequence from stomach 19 to stomach 30. Each of them, the interval is 1 cun. Okay, so another way is to remember them by Ren channel, right? Ren channel. Ren channel you haven't studied although, but later on when you study the Ren channel, that's even better. That's even better to remember both of them. Okay, so let's start at stomach 19. Okay, stomach 19. Stomach 19 actually, it's on the abdomen 2 cun lateral to middle line and the 6 cun superior to the umbilical. Okay, so if we divide this portion into 8 cun, right, from this is the this location, how to say that in English? So that's kind of
The sternum.
sternum.
Costal angle?
Yeah, I think the angle, right? So like the rib and the sternum bone, they have the angle, right? They form an angle from here to umbilical. So we divide it into 8 equal portion, right? Yeah. So each of them are 1 cun, 1 cun. So stomach 19, not from 8 cun, from 6 cun, right? About umbilical, 6 cun. Okay. So we actually can use this. We can use Peter Edmonds video. The video is very helpful because it's stomach channel, stomach. 19.
Udon, stomach 19, is located on the abdomen, 2 cun lateral to the midline and 6 cun superior to the umbilicus, level with Ju Ren 14. One, the 2 cun line is located halfway between the midline and the palpable lateral border of the rectus abdominis muscle. 2, in some patients with a narrow subcostal angle, this point may fall on the costal margin. The options then are to A, locate more medially, B, needle transversely on the costal margin, C, select a different point. Perpendicular insertion, 0.5 to 0.8 cun. Caution. Deep insertion may injure the heart on the left or the liver on the right if either of these organs is enlarged.
So let's look at it again.
Budong, stomach 19, is located on the abdomen, 2 cun lateral to the midline and 6 cun superior to the umbilicus, level with Ju Ren 14. 1. The 2 cun line is located halfway between the midline and the palpable lateral border of the rectus abdominis muscle. 2. In some patients with a narrow subcostal angle, this point may fall on the costal margin. The options then are to A, locate more medially, B, needle transversely on the costal margin, C, select a different point. Perpendicular insertion, 0.5 to 0.8 cun. Caution. Deep insertion may injure the heart on the left or the liver on the right if either of these organs is enlarged.
Okay, when we talk about caution, that's considered about a real location of Western massing organ. Okay, that's serious. Okay, serious. So to needle, you would say, from stomach 19 till stomach 30, all along this line, the points, all of them you can do perpendicularly acupuncture, right? Perpendicularly penetrating, but like different depths, okay, and different caution, of course. For in this area, so the left side, be careful about heart, right? If you do for a thin patient, you go very deep. That isn't hurt. Yeah, that's kind of like life-threatening situation. If you penetrating the heart, I don't think I never heard of that happen. Okay, and the right side is about liver, right? Liver, yeah. So 0.5 to 1 cun for thin people stopped at 0.5 cun. Okay, for like bigger one, yeah, you probably go deeper. Yeah, so usually it's safe. Okay, unless you go, I don't know, like didn't take any caution about that. Yeah. or we can go next point maybe, yeah, let's go next point. Almost similar things.
Shangwan, stomach 20, is located on the abdomen, 2 cm lateral to the midline, and 5 cm superior to the umbilicus, level with Shangwan, Ren 13. One, the Tooth-Tsin line is located halfway between the midline and the palpable lateral border of the rectus abdominis muscle. 2. In some patients with a narrow subcostal angle, this point may fall on the costal margin. The options then are to A. Locate more medially, B. Needle transversely on the costal margin, C. Select a different point. Perpendicular insertion 0.5 to 1 cm. Caution. 1. In thin subjects, deep needling may penetrate the peritoneal cavity. 2. Deep needling at right Shangwan stomach 20 may penetrate an enlarged liver.
Okay, from here it will goes to the cavity, right? Cavity. So abdominal cavity. Yeah, should take caution of that.
Young men, stomach 21, is located on the abdomen, 2 cm lateral to the midline and 4 cm superior to the umbilicus, level with Zhongwan, Ren 12. 1. The Tooth-Tsin line is located halfway between the midline and the palpable lateral border of the rectus abdominis muscle. 2. In some patients with a narrow subcostal angle, this point may fall on the costal margin. The options then are to A. Locate more medially, B. Needle transversely on the costal margin, C. Select a different point. Perpendicular insertion 1 to 1.5 cm. Caution. 1. In thin patients, deep needling may penetrate the peritoneal cavity. 2. Deep needling at right young men, stomach 21, may penetrate an enlarged liver.
So we just look at location. It's simple, right? 2 twin beside needle line, and each twin, every twin, and there is a point. And some point, like stomach 19, 20, right? Even 21, you probably perpendicularly, you very soon you touch the bone, right? That's rib. Yeah. So then if that's happened, you can take obliquely, right? Obliquely, or a little bit medial to that point. Anyway, so we will, it's largely the situation of the location like that. So let's look at these points one by one, their actions and indication. The first one is stomach 19. Okay, remember from here, stomach channel goes to abdomen. Okay, goes to abdomen. So they travel beside the middle line, 2 twin, right? Not 4 twin anymore. 4 twin is when it travels in the chest. Okay, so this point is 6 twin superior to the umbilical, right? So it's same level with Ren 14. Ren 14 have a similar situation, like each twin in the middle line, there is a point, right? So exactly corresponding to stomach channel. Yeah, so this one actually perpendicularly insert 0.5 to 0.8. You will find like lower points, right? They're getting deeper and deeper. Why? Because yeah, look at your abdomen, right? Getting more and more fat under the skin when it goes down. Yeah. So this point harmonizes the middle jaw and lowers the rebellion, and lowers rebellion, and descends qi, elevates cough and wheezing. Like I said, the points, their actions always related to their location, right? So this one still near to chest, right? Still near to chest. So besides a harmonized middle jaw and lower rebellion, lowers. So all of the points in this area, they take care of middle jaw, right? Especially when they above the umbilical, they take care of the middle jaw. And the upper several points, like stomach 19, stomach 20, they still work on chest, right? Help descends qi and elevates cough and wheezing. Yeah, the lower parts, lower several points, lower parts, the more focus on stomach, right? Stomach abdomen issue. Yeah. So this one, stomach 19, so it treat abdominal distension and gastric pain, vomit. Those are all about stomach situation, right? Stomach situation. Abdominal deficiency for rigors. Yeah, so that could be from large intestine or small intestine, or from the stomach, right? So but anyway, from here, it's more focused on middle jaw. Okay, so it deals with some cough, dyspnea as well, chest issue as well. So stomach 19 is sometimes selected for treatment of hypochondria pain, right? So compared to Ren channel, stomach channel is more close to this range, right? So outside, the lateral side, or we name that hypochondria region, right? Hypochondria region. So it's a good point to good local points to soothe the liver qi, deal with hypochondria pain. Hypochondria pain usually is viewed as liver issue, especially when liver qi is stagnated, right? So yeah, you can choose stomach 19. Usually we will choose like liver 14, right? Liver 14. But you still can consider about stomach 19 to help it. Yeah. Carla, do you have a question?
Yeah, I just because like this point is really, it's talking about, and you can see it's located on like really close to the rib.
Yeah.
You're talking about needling it. So if you're right on the rib on a thin person, or you're right on it, you can go a little bit more medial, and then would you needle it like laterally or medially or perpendicular? Like what would be this? It says perpendicular, but you can do a transverse if you're kind of trying to come off the rib, but then kind of go into the point, or.
Oh, okay. Here is the location node. Okay, so See, the children lines is located halfway between the and in some patient with a narrow subcostal angle, this point may fall on the costal margin, right? So the option then are A, locate more medially. Yeah, a little bit go. It's trying to avoid this rib margin, and B, needle transversely on the coastal region, right? C, you abandon it, right? Select a different point. Yeah. So for the patient, like very thin, right? You almost can see from outside the rib, right? So if the patient like that way, even transverse needling will cause very uncomfortable feeling, then you probably choose the other points. Okay, avoid this one. Yeah. Same as stomach 20. Okay, same as stomach 20. Yeah. Stomach 19, I would say yeah, not too often used. So for the stomach channels in this area, stomach 21 is a start point. 21. Okay, 21. The other points here, they can be just assistant. Usually we don't choose them as like principal points or primary points. Not so often. Yeah. Same as stomach 20, it's 5 joints superior to the umbilical, right? 2 joints lateral to the middle line. That means it's 1 joint below stomach 19, right? 19. Same as when you do perpendicular needling, it's easy to touch the rib, right? Touch the rib. So you go a little bit medially or to do more transversely on the costal margin. Yeah. This one, perpendicular insertion 0.5 to 1 trim. Okay. Take caution. Don't do too deep, right? If it's too deep, it may penetrate in an enlarged liver or may penetrate the peritoneal cavity, right? Yeah. So, well, this harmonized the middle gel descended remaining of lung and the stomach almost the same as stomach 19, almost same thing. Okay. So if you feel stomach 19 is very difficult, you can choose stomach 20 to substitute it. Yeah, maybe a little bit easier. The function is pretty similar. Stomach 21 is a start point. Okay, so you can mark it 2 or even 3 star, which we use it very often, especially for children, right? You eat too much, have a food retention, then cause the gastric pain. Yeah. So this one is 2 joints lateral to the middle line and 4 joints superior to the umbilical. Okay, it's same level with Ren 12. Ren 12 is a front move point of stomach. Okay, so you will study it in the Ren channel. Also, one of most important points in your body. Yeah. So 中脘 Ren 12. Yeah, we almost all the digestion issue or digestive tubes problem, right? We choose Ren 12. So this one same level with Ren 12, but 2 joints beside it. Okay, 2 joints beside it. We do perpendicular insertion 1 to 1.5 joint. So the only thing you need to take caution is don't penetrate the peritoneal cavity, right? If it's in the right side, enlarge the liver, right? So if the liver in the normal range, usually that's fine. You just need to worry about peritoneal cavity. But you never know, right? So the enlarged liver could be something even the patient don't know, right? So enlarged liver, they probably don't know. Yeah. So they just know, oh, I have a fatty liver. Yeah, they don't know the details, right? So always be careful about this issue. Yeah. 1 to 1.5 trim, that's pretty deep, right? So like the average people you insert just 1 trim. So this one regulate qi and elevates pain, harmonize middle gel, transform stagnation. Okay, transform stagnation. So raise the qi and stop diarrhea. Okay, so we explained that before. What's the diarrhea? Diarrhea because in qi can't sending up, but goes down, right? It just the good stuff and this waste getting mixed together and cause this diarrhea. Okay, that good stuff are supposed to be sending up by spleen qi. However, when spleen qi deficiency or there's too much dampness there, so those good stuff like essence, right, from the food, they will be mixed with the waste together and goes down. Yeah, that's how diarrhea happen. Okay, so this one can raise the qi. That's good, right? Raise the qi and stop diarrhea. Especially work on some we say the slippery diarrhea. What is slippery diarrhea? So that's a long-term problem, and some patients even get used to that. Okay, they went to the bathroom maybe 3 to 4 times a day, and it's like year on year, it's just like habitual diarrhea. Okay, but that's actually due to spleen qi deficiency, usually due to deficiency. Okay, so this point specifically, can save that situation. Okay, help raising the spleen qi. Yeah. So regular qi and elevate pain, harmonize middle GL, transform stagnation. Yeah, obviously it treat gastric pain, right? Due to qi stagnation, due to food retention caused to block the qi. Then qi accumulation in the lateral coastal region, right? So irritable IBS, yeah, it could be one of them. Yeah. So the qi accumulation in the lateral coastal region, like I said, that's usually because liver qi stagnation, right? Or gallbladder channel is blocked, so manifested as hypochondrial region. Okay, so this is good one. This is good one because it's located in that area, right? So qi accumulation below the chest, abdominal distension, yeah, vomit, poor appetite, rigor, slippery diarrhea, right? Undigested food, yeah. I would say the indications are very similar as REN 12, very similar as REN 12. Yeah, but this one is also can deal with lateral coastal region stagnation of qi, right? Let's say stomach 21 is an important point for treating distension and pain, right? We see distension pain usually due to what? Qi stagnation, right? So blood stagnation causes what? Blood stasis causes starving pain, right? Fixed location, starving pain. So the location is pretty clear. Where there's pain, there is, a blood stasis. But qi stagnation is larger range, yeah, and manifested as distending pain, right? Distending pain. Sometimes it's moved from here to there. Okay, so it's not so fixed. It's not so fixed. So that's the difference between qi stagnation and the blood stasis. So treating distension and pain due to stagnation of qi, especially in the lateral abdomen and the lateral coastal region. It's used in preference to or in combination with REN 12, right? REN 12. So when there's qi stagnation in the middle GL, we usually combine those two together. Yeah. So especially the gastric pain radiate to the hypochondrial region. Okay, radiate to the hypochondrial region. Yeah, to combine these 2 points together. Stomach 21 is able to regulate the stomach and spleen and transform food accumulation, right? Being indicated for vomiting, poor appetite, rigors, undigested food in the stool, and diarrhea, especially slippery diarrhea. Okay, so yeah, some textbooks said stomach 21 is an empiric point for food retention. Okay, so I would say yes. So looks like stomach 21 is a perfect one for food retention because it can move the qi, it can help transform food accumulation. So this, remember, yeah, especially children, right? When they have food retention, you can, if they don't want a needle, yeah, you can do acupressure on both sides, stomach 21, very helpful, okay? For the especially slippery diarrhea, this term refers to diarrhea, which because of persistent and chronic nature leads to downward collapse of qi, right? So the collapse of qi in turn leads to worsen of diarrhea, which become ceaseless both at night and during the day. Yeah, so the chronic diarrhea cause qi collapse, and qi collapse in turn to cause slippery diarrhea, right? Yeah, so in that case, stomach 21 can help the spleen qi sending up and save this, slippery diarrhea. Yeah. The use of stomach 21 is emphasized in Warwire's classics for epigastric pain and qi accumulation below both the chest and the lateral coastal region. So yeah, it's a good one for soothe the qi. Yeah, remember this, stomach 21. Then after it, stomach 22, right? 关门穴, stomach 24, 3 turns superior to the umbilical, right? It's same level with REN 11. REN 11, it's right here. Perpendicular insertion 1 to 1.5 turn. Yeah, so see from upper to lower abdomen, yeah, so there's more muscle and fat, in the lower part. The depth is increased, right? The depth is increased. So in these subjects, deep needling may penetrate in the peritoneal cavity. Okay. The action is regulate qi, elevates pain, regulate intestine, and benefits urination. See, from here, it's kind of take care of the lower abdomen, right? Lower abdomen. It's getting a little bit far from chest, but more closer to the lower abdomen. So it's regulate qi, elevates pain, that's in the middle GL, take care of stomach, and also help regulate intestines and benefit urination. Yeah, so this one, we don't use it too often, probably just no star. Indications, yeah, abdominal qi accumulation, sensation of qi moving in the abdomen, abdomen pain, abdomen distension, fullness, acute umbilical pain, right? So it's also helpful for some intestinal problem, right? Like constipation, diarrhea, right? A dysenteric disorder, yeah, even edema in urethus, yeah. Not too much about this one. Stomach 23. Okay, stomach 23. Yeah, I can mark it like 1 star. So this one, 2 turns superior to the umbilicals. So same level with Ren 10, okay, with Ren 10. So this one perpendicularly insert 1 to 1.5 trillion. What do you need to take caution? Same, right? Yeah. So to take caution, don't penetrating the peritoneal cavity. Okay. This point transform flame and calm the spirit. Yeah, that's why this point, deserve 1 star. Deserve 1 star. Yeah. So in the body, especially in the abdomen part, we seldom have points to can calm the spirit. We have some points on the chest, right? Because it's related to the heart or near to the heart. They can help calm the spirit. But this one in the abdomen also can transform flame and calm the shen. So that's why it has 1 star. Of course, it harmonized middle gel, right? So Tushun beside Ren 10, yes, Ren 10 is also important one for harmonized middle gel. So this one to treat mania depression, agitation, tongue thrusting, like mouth walking, and also like other points like its neighbors, right? Treat middle gel problems. Okay. You see, when we see points can deal with the calm down the shen, either it can clear fire, clear heat, either they can transform flame, right? Transform flame. This point transform flame. Yeah. This point can calm the spirit, treat psycho-emotional disorder, attribute to 3 factor, its ability like other points, several points of stomach channel, like stomach 40, right? 40 to transform a flame. So stomach 21 can do that as well. So later on, you will start the meridian theory. So stomach channel actually inside is connected. It goes to heart. It goes to heart. Okay, the internal connection between stomach divergent channel and the heart zone, right? The divergent channel of stomach that goes to the heart zone, and the meeting of stomach channel with the Goering vessel. Yeah, so that's connected to brain at points DO24 and DO26. So both of them are confluent points with stomach channel. So that's how why stomach 21 located at the stomach channel, but it can treat some psycho emotion problem. Yeah, here read this paragraph can answer, where the flame came from, right? So although there are many causes for the formation of flame, this harmony of stomach and spleen is the most common one, right? So that meaning the flame usually that they produced by spleen count transformation transportation, right? So stomach chi count descending and convey the waste. So that there is a dampness flame retention in the middle gel. That's the main source of the flame, right? Once formed, the flame or flame heat may rise to fill the portals of the heart and disturb the spirit, leading to those problems, right? That mania, depression, agitation, and mad walking. Yeah. And we mentioned that before, the tongue thrusting, right? Tongue thrusting, that's a sign of, abnormal, right? Abnormal shen, especially when the patient can't control that behavior. They don't know they are doing that. That's something wrong with their spirit, with their shen. Yeah. So usually that's related to flame heat, right? The heat block the heart, and the flame block the heart, and the heat cause this agitation of the tongue, right? The tongue is upset, and yeah. Right, these symptoms are most commonly seen in the pattern of flame heat accumulated in the spleen and heart. Yeah. We say the tongue is is an organ of the heart organ, right? Heart opens on the tongue. Yeah. So the tongue movement can manifest the situation of heart. It also can be a deficiency heat, right? Deficiency heat by kidney yin deficiency can't nourish heart. So there is an empty heat, empty fire in the heart. It also can be that way. Okay, so for stomach 21, dual action on psycho-emotional and abdominal distension rendered is especially suitable for conditions where both present together, right? So the patient who present with anxiety focus both on the chest and abdomen, accompanied by palpitation, tightness of chest, abdominal pain, and diarrhea. So especially when they combine together, yeah. So this is a best choice for that kind of situation. Yeah. Okay, so let's have a break, 10 minutes. Okay. Okay, please come back. Okay, so next one is stomach 24, right? Stomach 24. Yeah, it's 1 turn below stomach 23, 2 turn lateral to the middle line. It's the same level with Rennan. It's Rennan. Okay. So 华肉门 stomach 24, not so often being used. Okay. So let's look
Yeah.
at this. What's the example set? Is that probably stomach no star, right? Yeah. No star.
Young men.
Oh, where it is.
Young men, stomach 21.
not often used. So just no star. Okay, no star. Perpendicular insert 1 to 1.5 turn. Same caution, right? When you needle points located in the abdomen, so they especially around the umbilicus, the only concern is what? You don't do too deep to penetrate in peritoneal cavity. The actions of this one transform flame and calm the spirit, harmonize stomach elevates vomit. See, same as stomach 23, right? Same as stomach 23. So kind of stomach 23 covers function, cover its function, right? Stomach 24, almost same thing. Yeah, but we usually, if that's the indication, we usually choose stomach 23. Yeah. Okay, then next one is a big star, right? Big star. Yeah, so you can mark it to 4, even 4, right? 4 stars. Stomach 25, 天枢穴. So it's a front move point of large intestine. Okay, remember this. Front move point of large intestine. Okay, we studied the back shoe point of large intestine, which is BL25, right? BL25. So this is the front move point. Front move point. So it's located on the abdomen, two turn lateral to the umbilicus, right? It's easy, two turn lateral to the umbilicus. Penetrate, perpendicularly insert, penetrate 1 to 1.5 turn. Okay. Yeah, sometimes I saw the students, in the clinic, for a person like even weak person, you just put 0.5 turn. I would say that's too shallow. Okay, that's too shallow. So it has to be 0.8 or 1 turn at least, unless that person is like skinny or initiation, right? Like even weight, average weight, insert 1 turn. Okay, insert 1 turn. We are doing body acupuncture, not doing abdominal acupuncture, right? If you do abdominal acupuncture, that's another story. So you can do shallow. But body acupuncture follow the different rules, right? Like this is insert at least, yeah, one turn. For fat people, like big weight, yeah, 1.5 turn. Okay. The function of this one is very like wide range. Regulate intestines, of course, frontal point of large intestine, regulate spleen, stomach, resolve dampness and damp heat, regulate qi and blood and element stagnation. Okay, here, regulate qi and blood element stagnated. What? Stagnated in where? Mainly about, under stomach, right? Abdomen and uterus. Abdomen and uterus. It's kind of, yeah, take care of the lower parts. So based on that, it treat diarrhea, all kinds of diarrhea, right? All kinds of excessive pattern and the differential pattern, and also constipation, right? Diarrhea, constipation, that's the main disorder of large intestine. Secondly, it helps to deal with this, the edema, drum distension, swelling of the face, typically painful urinary dysfunction. They deal with this, right? Regulate spleen, stomach, resolve dampness and damp heat. Okay, help to regulate the water passageway. Yeah, not a main point for this purpose, but it can help. It can help. So above it, that's Rennan. Rennan is a stronger one to deal with water, okay, compared to stomach 25. But stomach 25 can help. For vomit, retching, difficult digestion, poor appetite, sudden thermal disorder. Since it can regulate spleen and the stomach, right? Harmonize spleen, stomach. It helps to deal with that as well. So that's why sometimes we combine Ren 12 and stomach 25, combine these 2 points together to deal with digestion problems, especially when those digestion problems cause constipation or diarrhea. Okay, so we combine stomach 25 and Ren 12 together. Yeah. Abdominal pain, abdominal distension with labored breathing, intestinal abscess, generalized swelling with severe cutting, umbilical pain, umbilical shunt disorder. Shunt disorder is herniation, right? Herniation of the intestine with localized pain that periodically surges up to the heart. Shunt disorder, running peachy. It takes care of all of this area around the umbilical, the situation. Yeah, it can soothe the qi. Okay. Especially I marked here, sometimes you may ignore that or forget that. It also treats abdominal mass in women, right? Uterine problem, pain of the uterus, dysmenorrhea, irregular